Another trauma patient here. We have a patient who was struck by a vehicle and presents with hypotension, flat neck veins, and absent breath sounds on one side. What is the most likely diagnosis? Would it be A, pericardial tamponade, B, tension pneumothorax, C, hemothorax, or would it be D, a pulmonary embolism? Now, you got to know whenever I see hypotension and I got absent lung sounds on one side, everyone always wants to point out a pneumothorax. But remember, if this pneumothorax was under tension and it was under tension for a while, this would cause distension of your jugular veins. In this scenario, the patient has flat neck veins because there's a decrease in volume. Well, why is there a decrease in volume? Because that volume is going into the chest. We call this a hemothorax. Now, hemothorax means that there's blood in the pleural space between the lung and the chest wall. And the problem here is that there can be a substantial amount of blood filling up in this space. Ultimately, this patient's going to require surgery and a chest tube as soon as possible. So the sooner we get to a trauma center, the better for the patient. Now, medics, be careful when answering these type of test questions on national standard exams. We do not needle decompress hemothorax. Instead, we want to improve perfusion and allow for this patient to ventilate. How do we do that? Well, if they are hypoventilating, we need to assist their ventilations. Never forget that using positive pressure ventilations is something that we need to consider whenever we see the term shallow breathing on an exam. And I will always try to deliver whole blood if possible. And I will always try to sustain a blood pressure of at least 90 on these patients. The answer here is C, hemothorax.